In the same way that seasons change, so does our life. And as always, Studio 10 is always looking out for you, so those changes are absolutely seamless. And today, we have Kyle Ingram in studio with us today, and he's going to help make those changes a little bit easier. How are you this afternoon?
Great. How are you doing?
I'm doing very well. Thank you so much, especially because we're going to have a really important conversation this afternoon. Today, I wanted to talk about the importance of reviewing our Medicare coverage. So, Kyle, tell us, what are some of those important Medicare plan changes that happened during open enrollment?
Yeah, 2025 was a big year for Medicare changes. The largest was brought on by the Inflation Reduction Act, which brought in a huge savings for our Medicare members, and that's the $2,000 cap on prescription drug costs throughout the year. So in the past, it could have been all the way up to $8,000 out of pocket for the prescription drugs. Now there's a cap at $2,000. You will not have more than an out-of-pocket payment for that. On top of that, if you are having high-cost drugs, and it's something that costs you a lot every month, say $600 a month for your one prescription, there's something called the Medicare Prescription Payment Plan this year that allows you to spread that cost across the year. Now, it's not always the best fit for everybody, but if it works out for you, talk to your agent, talk to your broker, your carrier, see if it's something that will work for you. It is something that is available to every member with every carrier this year.
Yeah, and Kyle, I think it kind of goes without saying, but why should people review their coverage each and every year?
Well, you kind of said it when we introed in. Your life changes. Things change about you every year, and so does your plan. So you really want to make sure that you're reviewing your benefits every year, seeing if it still fits your situation that you're currently in. Because what's going on this year may not have been what was going on last year when you picked your plan. So you really want to make sure that you're going through those reviews every year.
Exactly, and that's how you can make sure nothing is really falling in through the cracks.
Exactly.
But now, how do you recommend beneficiaries compare those different plans, especially when it comes to costs or provider networks and covered services?
Sure. There's really three ways you can do it. You can do it yourself. That's always kind of the tricky way, right? You were used to, say, when you're on commercial coverage, having an HR professional help you figure out all those changes. I suggest going the same route. Either use your carrier, work with an agent or broker in your local community, and make sure that they're able to sit down with you, talk about those changes that are going on, and that it's something that still fits for you.
Absolutely, and some things you got to have a conversation about to really make sure you're understanding, and everybody's on the same page too. So what happens if someone misses open enrollment, or they simply renew their plan without reviewing the changes first?
Absolutely. You have to wait then until the annual enrollment period. So there's a few different enrollment periods throughout the year. You have your annual enrollment period, that's October 15th through December 7th. We're currently in the Medicare Advantage open enrollment period. That's January 1st through the end of March. That's where somebody who's currently on a Medicare Advantage plan can make a one-time plan change. If the situation's not working out for them this year, they want to see or try another Medicare Advantage plan, they can by utilizing that option. If they don't by the end of March, either you have a special election period throughout the year, or you're in it until April or until October of the next year.
So January 1st through the end of March. We only have a few days left, really.
Correct.
So you recently actually expanded your network. So what does that mean for local communities?
Yeah, super excited to talk about our expansion, especially here in the Lansing community. It is something that, adding in Sparrow into our network, Eaton Rapids Medical Center, there is the Wexford PHO. There's a lot of different groups that we're working here, along with our already established relationships with McLaren, MSU Healthcare, who we have a great partnership with. So really excited to just expand those options, make sure that members have the accessibility to the providers in their neighborhoods.
That's right. Well, Kyle, if someone's interested in seeing which new doctors or hospitals are now in network, where can they go for more information?
HAP.org/Medicare.
That's right. Well, everybody take a look at your screen. We have that information below. And if you want to continue that conversation with Kyle or anyone in HAP, of course, head to our WILX website. We'll have even more information there for you. But thanks for breaking all this down for us.